So hi everyone, and welcome to our summer lunch and learn. We're very lucky to be joined today by members of the Linwood Charlton Center who will be speaking about meaningful engagement of youth and families, policy planning and considerations for mental health organization systems. I'll just give a quick brief about what the Offered Center is. So we are a multidisciplinary research institute established in 1992. So through collaboration across fields such as child psychiatry, psychology, epidemiology, pediatrics, policy development, social work, and nursing, the center's aim is to better understand children's mental health problems with the overall goal of improving the lives of children and youth. So that's just kind of what the Offered Center is. So that's why this is such a relevant session for us today. So now I'll pass it over to Laura.
Thanks, Nicole, and thanks so much to Haruka and Louise for doing this session. So I'm just jumping in briefly just to totally big up Haruka and Louise for the work that they do with the youth family engagement. They've been involved with a number of projects at the Offered Center, and I feel like we've really forged a lot of partnerships on a number of different projects, and it's really increased the value of a lot of the work we do. I'm constantly learning about engagement, and Haruka and Louise are always there to listen and answer questions. And it's just been, for me, just such a valuable partnership. So I wanted to thank them. And I think you're all in for a treat with their presentation today. So I'm going to just hand it over.
Thanks, Laura. We're thrilled to be here, and I think it's a good example of the engagement that the Offered Center does. And having known Laura for a few years, that a little ask about sharing some engagement resources turned into, hey, we could share some information with people who are in the public health program, and then that turns into this. So it just grows, and that's very much what real meaningful and authentic engagement is. It's just conversations that turn into something better than anyone thought at the beginning. So hopefully that's what it'll feel like a bit for you today, as you try and squeeze in your lunch in the middle of all the other Zoom meetings that you're probably scheduled, or classes, or work, and other things you're doing. Haruka, you were going to actually be the one that started us off, right?
That's okay. I think you're following the slide, so I'm okay with you to keep going.
Okay, well, this is what we're here to talk about today. And to be honest, we had some presentation slides that we had used previously, and late in the day yesterday, we ended up flipping the presentation completely. So you're getting a new experience for us as well. So hopefully it'll work out. So before we really get into anything, though, I think it's really important for us to pause and really begin by taking the actions that we can each and every day to respond to the calls to action for reconciliation with our Indigenous peoples. We want to recognize and acknowledge that wherever we may be today, we are situated on lands that are traditional territories for Indigenous peoples throughout the land we refer to as Canada. And Indigenous peoples have been here from the beginning, and that these lands have nurtured and sustained families and communities who've gathered here for thousands of years. I'm personally speaking to you from my home, and I'm situated on the traditional territories of the Anishinaabe and Haudenosaunee nations and the Mississaugas of Credit First Nation, which is all governed under or not governed, but protected by the Dish with One Spoon Wampum Belt Agreement. One of the other things we'd like to mention as well is acknowledge that the Offered Center and us with Linwood Charlton Center and Child and Youth Mental Health Sector and all the work that we're involved in the community, wherever you may be, that we as individuals and organizations can support reconciliation through relationship and contribute to efforts that close the gaps between Aboriginal and non-Aboriginal communities across a number of health indicators, including mental health, addictions, and suicide. So we appreciate you coming together and keeping everyone in mind in the work that you do and in our conversations today as well.
Thank you, Louise. So I'll start a little bit with an introduction for myself, my name is Haruka. My pronouns are she and her, and I'm the current youth engagement lead at Linwood Charlton Center as part of Lead Agency. I bring the youth voice, and I also like to think of myself as an ally in bringing their experiences into system planning as well as program or development within the child and youth mental health. I also recently graduated from University of Toronto with an MSW, and so it's nice to see a lot of students here in the space here today as well. And I also have another role as a Your Space Hamilton project coordinator, which I work with Louise around supporting youth and families while they wait for services.
And for me, I am a family member with lived experience, and I have 2 roles at Linwood, same as Haruka, both system level, family engagement lead and with the Your Space project. And I also am a Parents for Children's Mental Health chapter leader here in Hamilton, and provide peer support to families. And PCMH is the family support program that is now under Children's Mental Health Ontario. And thank you to everyone who's been sharing in the chat your name and role. I use pronouns she, they as well, and I'm working towards building my skills as an ally for youth and for families. Okay, so current context, always helpful. So the big picture is that internationally, there is a growing movement across health, social, community services related to human-centered design or co-production, co-design, engagement, partnership. There's a lot of different terms that are used, different models and approaches that essentially have the same core values that people who use services have knowledge and perspectives and interests and are a stakeholder with as much of a stake in all of the systems and programs and services that exist in communities, and that it's very valuable, and you get better outcomes, better services, better experiences when all those perspectives are involved. Examples in our Ontario context, patient declaration of values, Ontario health teams in their guidance documents have quite a bit. Moving on mental health is the provincial initiative that governs the child and youth mental health service work that we're involved with Linwood Charlton Center, and there's expectations there for youth and family engagement. And so Linwood is the lead agency in the Hamilton service area under Moving on Mental Health, and as a community, we're a group of 10 child and youth mental health providers providing community-based child and youth mental health services. And the priority that was and has been consistently identified since the beginning in 2014, 2015, was to increase capacity for meaningful youth and family engagement in the child and youth mental health sector. And so we do that in collaboration with those 10 core service providers within that portion of the child and youth mental health sector, as well as more broadly in the community. Through working with community partners and beyond. So that kind of ends up looking like this. And for us in youth and family engagement, we really try and focus on keeping the child, youth, and family at the center. They are the why we do what we do. And so when we keep them at the center, then we have these kind of support circles around. And we like to say that we're here, and that's at the bottom of all these overlapping, intersecting circles. And especially when we bring those lived experience and lived expertise perspectives, that they're all layered in there. And in our local community, we have connections that are our personal community connections, might be the school that we go to, or the place that we live, or the faith community that we belong to. And then the public community, there's those services that are broadly available. And so those child and youth mental health services sit in there. The Offered Center sits in there as well, in terms of being connected and based in our community. But we all spread and have our reach and our connections out into the provincial sphere as well. And that's where those provincial initiatives, legislation, mandates from ministries and things like that are there. Is that making sense to everyone? hopefully that's kind of how you see it too in all your various roles. And so moving on mental health and lead agency model is sitting in that green circle and hopefully surrounding and keeping children, youth, and families at the center. So Haruka, yes, over to you.
Thanks, Louise. So now that we have a little context of the spheres that we work in, we just wanted to share what is engagement and why does it matter? And we just want to make sure that we're all on the same page because there's lots of different terms in use in various contexts and sectors as well. There's parent engagement, student engagement, patient engagement. And so we just wanted to provide a definition that we work from. If you'd like to go to the next slide, Louise, that would be wonderful. Thank you. So these are the definitions of youth and family engagement that we work from. The definitions are created by the Center of Excellence for Child and Youth Mental Health, and a lot of our resources that we share today actually come from the Center of Excellence for Child and Youth Mental Health. And so for youth engagement, it's about empowering youth as valuable partners in child and youth mental health to address and make decisions that affect them personally and know that they believe to be important. I really like that part, and that a lot of the youth or the work that engagement is part of should be something that youth and families are interested in and that they believe is important, not something that the system thinks is important. So just valuing that perspective. For the youth engagement side of things, we use a developmental definition of youth. So we don't really have an age range. It's just if you identify as a youth and bring that perspective forward, then we just love to hear from anyone who bring that perspective. And we also view engagement as existing on a continuum, which we'll get into in a little bit as well.
Okay.
Oh, I didn't touch on the family engagement side of things, but if you wanted to go
should have noticed that. Sorry. My keyboard suddenly stopped working. So I was like trying to figure out why I couldn't type that chat message I just put. Yes, sorry. Family engagement is that ongoing process that includes families as active decision makers and partners at the organization and system levels. And that was, that definition came through a co-development process around the provincial quality standards, and ongoing is a keyword. Active decision makers and partners are also keywords as well in there for families. I think that covers it. We're all good. Hart's ladder, if you're familiar with Roger Hart and his work on his own ladder, Hart's ladder of participation, and that was children's participation around 1979. And it's been used as a basis for a lot of engagement models. And so this is what we also use as a foundation, not exclusively though. There's lots of good work out there that have adapted and created other models. And so we try and capture all the great things that are out there from other things as well. But in essence, we kind of sum it up as those lower levels of engagement, manipulation, decoration, tokenism are experienced as doing two. That's disengagement. We definitely want to avoid those. And those are just not meaningful for youth and families. At the informed level, it kind of feels more like doing four. Some information gets shared out to youth and families about what services providers are doing for them, and not so much with them. Moving up to consulted, where people are actively sought out to share thoughts and ideas and opinions, and then providers, agencies, organizations go off and do work that's kind of based on what they've heard in that feedback. And so that's kind of the working for level there. And what we really are always striving to have available is co-development and partnership, which fall under the working with. We're doing things together. We're alongside, those perspectives of children, youth, and families are valued, seen as necessary, and decision-making. The more that decision-making and power is shared, the more it becomes partnership. And we acknowledge not everything can be partnership. There's lots of barriers and limitations, but there's aspects of everything that can. And so when we look at the Hart's ladder, we really like to say it's not lesser to better. It's really you want to say, all right, those lower levels, if those are happening, there is an attempt, there is an effort, to bring someone in. For instance, having a place on a board of directors for a lived experience perspective. If that's done well and it's meaningful, then it can be up higher on the level. If it's someone comes to those meetings and their input has very little weight because there's 14 other people there with voices and more power, then that can be tokenistic. And so it's not so much what you're doing, but how it's done that influences where you are on that ladder. And when we think about equity and diversity and inclusive practices and approaches, it's really important that we're offering as many of those upper levels as options for people within the same project, same initiative, because people's lived experience have different ways that are meaningful for them, and we don't define what's meaningful for them. They define what's meaningful for them, and the more options we can offer, the more they can connect. Not everybody has time to be part of a system level work group or daytime availability, and sometimes people are like, you know what, I just want to say my piece and share my ideas, and I'm okay that it gets taken off and something happens with it. And so that range of opportunities is important. It's about real choice, and it's not so much about the toddler in the morning where you say, you want the red shirt or the blue shirt? It's really about saying, hey, here's your cupboard, here's your drawer. What's important to you today? Haruka, anything to add there?
No, I will cover it in the next slide with the traffic light.
Okie dokie.
Okay, so this is the youth engagement traffic light, which was developed pretty recently with youth, and I was part of development as well. And so it kind of captures the same idea and nuances, just instead of a step this time, it's a traffic light. So we're using different analogies this time. And so for the red light, the stop, we don't want to be doing those. Manipulation, decoration, tokenism is reflected there. For the yellow light, where we kind of take that pause and think about how we're doing informed and consulted, just because it isn't at the highest level of engagement that we could be achieving on. So there's more to think about and consider when we are doing engagement at the yellow level there. And then lastly, the co-development and partnership side of things is the go. We want to be achieving engagement at this level as much as we can. And it's difficult at times. To be completely transparent, a lot of the engagement work that we do sometimes gets stuck at the yellow and at the informed consult level too, just because of different barriers that we experience in doing engagement, which we'll get into in a little bit. So knowing that and just being transparent about that with youth that we are working with, I think is really important too. And as Louise said, youth are taking on multiple hats in the work that we do. A lot of them are students, a lot of them have part-time jobs. They're carrying on other roles within the family too. And so to be considerate of that and know that if a youth need to be engaged at an informed consult level, like Louise said, it's the how, and how do we make that informed level be as meaningful as we can, so that the youth don't feel that they're just being given a document to review and go over, but create a time and meet at a time that works for them to inform those documents. And so we'll get into the hows in a little bit in the slides afterwards, but this is just a different way of thinking about engagement at the different levels too, and how it definitely exists in the continuum.
If you have any knowledge or resources that relate to engagement or partnership or co-design, and you have some thoughts that could grow our understanding, please feel free to share in the chat or connect with us afterwards as well. Okay, it's still you, Haruka.
Yes. So these are this different, not 9, I believe. Yes, 9 different quality statements that make up the quality standards for youth engagement. It was again developed by the Center of Excellence for Child and Youth Mental Health, and Louise and I are very grateful to have been part of that co-development process with youth, families, and providers from all across the province. And so for the youth side of things, we've identified the different points on the slide there as the quality statements. And when we're doing engagement work, we just think about what standards and what statements are applicable to this work. And oftentimes it's all of it. And so we try to make sure that we are hitting the bar for all the different statements that are listed on the slide there. And I will share the resource for this in the chat, but it's a 50-page document, but I promise it's all really good stuff in there. That includes detailing the background, rationale, best practices for each of the statements, as well as defining what each one means for youth, agencies, and decision makers. So there's different perspectives that are captured in the big document there that I'll share in a little bit. And for us, it's really been helpful in working towards implementing the standards into engagement work. Previously, we didn't have anything to really work off from except for the experiences that we've had. But now that we were able to bring our experiences into 9 different statements, it creates more of the accountability piece for us to embed engagement work, as well as to share about engagement work as well, and to kind of have a guideline that folks can work from. So that's on the youth side. And I will share on the chat in the chat.
On the family side, very similar, but also key differences. The quality statements, or as they're referred to in the center's resources, principles for high quality engagement, youth or family. On the family side, there's 8 different statements, and I would say that anything that's different on the family side, a key difference was about the way that youth and families experience relationship building and power sharing differently, and what's necessary for feeling comfortable in spaces. Families, well, youth, it's a super high priority that they need to feel, in order to feel meaningfully engaged, the spaces that they're in need to feel comfortable. And that is also true for families, but in terms of how that got decided in the co-development of the quality statements, is that is more embedded in the experience of co-development and partnership on the family side, and the empowerment in there as well. Authentic relationships, very important for both sides, to feel that you can share things that need to be shared and feel that they're going to be heard. And that means that everybody that's coming together in any of these spaces come with a degree of vulnerability. With youth and families, it's clear where that vulnerability comes from, that difference in the power that's held, and for some people and groups and communities, there can be a lot of layers there that we're always striving to do better around. So that diversity and creating inclusive processes and spaces is really important, and definitely links to that ongoing learning that we're committed to. In order to be meaningful and authentic around that, we really do need to come when we are the ones that hold more power, because we have more of that decision-making capability, then we have to be able to kind of put that mantle of power down at the door, or the link, however we're joining spaces, in order to be open and engage and really kind of fulfill all of these principles. All right, so that's what is engagement under the model that we work from. And so why does it matter? Haruka, you were going to start with this, I think, though, weren't you?
So why engagement matters. And I think that looks different from all the different perspectives that we are bringing forward within their roles, as well as our past experiences as well. But we kind of wanted to bring it back to why it matters for youth and the families who are part of engagement work. And our approach to engagement emphasizes the importance of meaningful engagement. And so we've been using that term throughout the presentation and we'll continue to do so. But we just definitely feel that if it's not meaningful for youth and families, then we haven't achieved authentic engagement, which is also part of the statements as part of the quality standards. But it allows youth and families to feel heard, be valued for their unique knowledge and expertise, and share dialogue, decision making, and know that their contributions make a difference. And what's really unique about the experiences that they bring is that within the mental health context, there's often that stigma that allow them to kind of not allow them, but it places them in a place where they view their experiences as negative or stigmatized at times. And in our context and engagement work that we do, we don't look at it that way. We value their experience, and what they are bringing forward is going to improve the system and the access and the experience for other youth and families who are accessing services. And so to feel that empowerment is one of the reasons that I truly genuinely enjoy engagement work, in that I think it places the power back to the youth and families for their experiences that they're bringing forward. And so this is what we also heard from our team members, which we haven't mentioned in our presentation yet, but Louise and I work with, I get to work with 5 youth. Louise gets to work with family members on the youth engagement and family engagement co-development team as part of lead agency. And I know some of our youth and family team members are here today during our presentation. So I just wanted to say a quick shout out to all of them. And we're so grateful to work with them. And this is what they shared around what meaningful engagement means to them. So all credit to them.
Definitely. I would just reiterate what Haruka says about the why does engagement matter and where the meaningful is, and say again that we don't determine what meaningful is. The people who are engaging determine what's meaningful, and we need to be open to understanding that. And that's how we ensure that engagement in any level that you're working on it, that it isn't a checkbox. It's not a layer. It's not an add-on. When you're really kind of bringing in and understanding that full perspective, it's the missing piece in a puzzle. And whatever area you work on, there's going to potentially be different pieces, or maybe there's a certain project where you need these pieces. As an example, if we're working with a particular provider that has a service that's unique in the city, then we need the pieces of the puzzle to include people who understand that particular service from the inside as the provider, or the staff who actually delivers the service, or the youth that have experienced it, the families that experienced it. And sometimes, and oftentimes, there's research projects or research perspectives in terms of best practices and service modalities that can be brought in as well. And all those pieces create that full picture. And when any of those pieces are missing, we're probably not going to end up with the result that we know could be achieved. And I think any of that human-centered design, that whole approach of involving more people with those perspectives, is about understanding maybe where there's been pieces missing all along. And I think at this point as well, it's really important to say that many people involved in all of this and all the things we do wear or bring multiple perspectives. It seems very rare, especially over the last year, that there's a provider at a table who doesn't also understand in some ways quite deeply what the lived experience perspective is. And there's young people and families who actually come from other knowledge perspectives because of their own education or professional work. And so being able to understand and acknowledge that helps level those power differences and understand that you know, when we see people as whole people and that their whole experience has value, and creating spaces for it to make a difference. Okay, we're good. We're good. Okay. All right. We tried to make this snappy, but still have a title that's like 80 characters long. Okay, so 5 ways we're going to go through this now. And we will do a key takeaway thing at the end, which basically sums up those same words. And we will share slides and things afterwards as well. Okay, here we go. Make meaningful engagement a priority. So not just make engagement a priority, but make meaningful engagement a priority. And that means looking at Hart's ladder, looking at the options and figuring out what those layers could be and whatever it is that you're doing. Communication is so important throughout anything and at all levels, and really recognizing where those missing puzzle pieces are and reaching out and building connections to create those opportunities. We're going with the short and sweet here, but if you have questions or want to know more detail, we can definitely pause. So share in the chat if you do.
And these are learnings, again, from our youth and families that we work very closely with, that outline what meaningful engagement looks like and what meaningful engagement is not. And I won't go through all of them, but I just wanted to highlight a few that stick out to me, which is for the meaningful engagement is side of things, is the third one here, having conversations with providers in a shared space. Oftentimes it's the youth and families are kind of in a separate space and providers do their work, and system work is really, really fast. And sometimes engagement takes a bit longer. We often say engagement is very messy, and that's the approach that we work from. And sometimes those timelines don't align, but as youth and families shared, it's just so meaningful to have everyone in one space having that conversation, because provider perspectives are just as important as youth and families in providing that context and understanding how the system is. And I think youth and families learn a lot from that as well. And just hearing directly from youth and families around the nuances. Minutes don't quite capture that often. And so youth and families often share that they enjoy sharing a space with providers, but in doing that, they have to feel comfortable in sharing feedback as well. So I'll share a little bit about how we work towards establishing a safer, braver space that allow youth and families to allow them to feel vulnerable as well. And then the last one is really important, getting paid for what they do. They bring so much to engagement work and bringing their vulnerable experiences forward. And honorarium is something that we definitely think about when we're doing engagement work. Also, the one thing we miss in here is snacks. Youth and families often say snacks make it the best, but yeah, it's a little difficult with virtual settings. And on the flip side of what meaningful engagement is not, I'll touch on the first point in a different slide afterwards, but the being asked to review a document after it's done, instead of sending it to them afterwards, invite them to create it with you. And that hits the co-development partnership level of creating something together. And the last one also is really important too, for getting things in the parking lot. Instead, intentionally make space to explore challenging issues or conversations. The challenging conversations that we often have with the teams are the ones that I learn the most from. And it allows also youth and families to feel more genuine and authentic in the engagement work that we're doing too. So just wanted to highlight that one. But Louise, if there's anything else you want to highlight, feel free to do so.
I think from family perspective, what meaningful engagement is, the second point about having background information, that can sound really boring and time consuming, and sometimes it is time consuming, partly because often youth and families are included later in processes. So the longer you wait in a process before you say, okay, let's check in with youth and families and see if all this stuff we planned is gonna, if that makes sense to them. The longer you wait, the more background info you have to share. So wherever they're engaged in a process, it's important to know what is this about, and that we'll talk about that in another section as well. But I find that bringing that critical thinking perspective is super, super important, because sometimes, and this is true in many things in life, sometimes we know the really good things to do. If we don't know the unhelpful things that we might also do, sometimes the good is kind of washed out and negated by the unhelpful stuff. So understanding both, and if you're thinking about something you're planning or you're reaching out and trying to create something, sometimes youth and families also need to have that understanding and knowledge as well. And so we're all coming at it from different points of understanding and knowledge. And so ensuring that youth and families have learning opportunities so that they have the understanding that's helpful, whether it's the project or thing that you're working on, or also what you're trying to do around meaningful engagement. Because sometimes youth and families can just be so used to not being included that they're grateful for anything. And in the big picture, if you stand back and have a good understanding, you can say, oh, wow, they were so grateful. They said this was wonderful and thank you so much. And taking that critical perspective, we might be able to say, you know what, I engaged them right at the very end. They didn't actually have any role in decision making. We never let them know what happened with the input they gave. Being able to actually look at that, and because sometimes, evaluation and finding out what people's experiences are like is really important. And we're struggling with trying to understand, a really positive feedback if from a best practice perspective we can see where things we did, and we make lots of mistakes. Haruka and I, we do. Well, I won't speak for Haruka, I shouldn't anyway. I make lots of mistakes, and sometimes I'm like, people are just really kind and generous sometimes, and that goes both ways as well. And so thinking about that, bringing that in, is sometimes really, really helpful too.
And so this is a very real quote that was shared by a young person that we work with around. A lot of us are talking about engagement and the importance of it, but when we're actually carrying out the engagement opportunities, sometimes it's not really hitting the par of what it actually is meaningful. And so this quote I think about often, and just reflecting on my own work doing engagements around, is this meaningful for youth and families, and how can I be doing better, and how can it be more intentional? And we always have blind spots too. And so just learning from each engagement opportunity that we do, and also hearing from youth and families around whether or not we are doing it in a way that feels safe and okay for them to be part of, is something that we definitely think about.
Very much so.
And so the key takeaway number 2 is ensure safer and braver spaces. Spaces of safety, equity, and power balance that allow youth and families to feel brave in sharing and bringing their perspectives forward. And engagement is about including those with lived experience in spaces of power. And oftentimes when we're sharing that space with providers, it doesn't often feel like that too. So we need to be intentional about creating that and acknowledging the power dynamics that might exist too. And sometimes it's about being transparent in that providers may hold a lot of power. They might have, the youth and families might see them as providers that provided services to them. And so there's that power dynamic there already. So I think of the therapeutic alliance often from like the social work perspective side of things around just balancing that out, and creating a space where we're all learning together and there's no power dynamic there as much as we can. And if there is that sense of that dynamic there, then just having a transparent conversation about it, whether it's a debrief or a check-in individually with the youth and family team members, or as a whole, group norms are really, really helpful in that. Check-in activities are often really great for that too, in kind of just easing out that familiarity with each other, and over time that relationship definitely builds, which allow youth and families to feel more comfortable, feel more safe in sharing. And so when we're thinking about the safer, braver spaces, it's beyond that physical space that we often think about. And that's really important too, in terms of accessibility and time of the meeting. And I think that's often thought about as well. But that nuanced feeling piece is something that we try to work towards in making it safe for everyone as well. Because when oftentimes when we talk and reflect back on the different meetings that we've had as part of engagement, it's often that feeling piece that sticks with us. And it's that gut feeling of, oh, that didn't feel great, or no, that felt really awesome. Even if the content of the meeting didn't get as far, it means that we spent time on establishing that safety and that relationship with folks that were in that space. And so multiple meanings for the space piece, but just ensuring that it's safe and brave all across both physical and that feeling side of things.
What I always like to add for this is that, we focus on, emphasizing and elevating the importance of safer, braver spaces for youth and families. And we have learned that in creating those spaces and for truly engaging, that means providers, organizations, staff, researchers, they need to feel pretty safe there. And feeling safer doesn't necessarily mean not feeling vulnerable. Youth and families are automatically vulnerable because often the things that they're choosing to engage with matter to them very, very deeply because they have personal experience that connects to hard things or good things or people that they care about or really strong feelings. And we know how emotion connects with memories when humans have experiences, whatever they may be. And the stronger the emotion, the stronger those memories can be. And so when we're in engagement or co-development spaces and we're talking about, it may seem innocuous. Okay, we're going to look at a document that's about this particular program. And if someone's experience of that program is going to link to a time in their life, perhaps a very recent time, maybe even a current time where things are really challenging, that's there. It's right there with them in that experience. And so youth and families are automatically vulnerable in that way. And providers, to choose to be vulnerable from a provider perspective, I think we're growing in our understanding of that. And we kind of exist in this in-between space where, I work for an agency, but I don't consider myself a provider. I'm not one of the staff, and I don't deliver the service that someone is receiving. But I think we're learning that means providers also need to trust that those individuals that are there at a meeting, in a conversation, we have to remember that they're a whole person too. And they don't do this work because, we joke a lot. People aren't in child and youth mental health for the money. And that is very, very true. People are caring people and they do this work and they want to help people. And we want all of those individuals as human beings to be able to go home and feel good about engagement too. And if they go home feeling like, wow, I got a lot of feedback there that actually is feedback that my program or my agency or my service or community owns, we want to be acknowledging that. But that doesn't mean we can't speak truths and share those. And so there's a certain amount of conversation and understanding, and that relationship building can be really, really helpful for that. And so I think that's something that we like to acknowledge and talk about as well. Okay, partnering with youth and families from the beginning. When we say the beginning, everyone may have different definitions of the beginning, and this is very, this is the movie Inception, or that meta experiences when there's the picture and the picture and the picture and the picture, and all the mirrors reflecting. So we can take the development of a new program from start to finish. Okay, what should that program be? What is the service that it's providing? What kind of information needs to be there? Who is it for? These might be early decisions, but also within the development of a new program, there may be, okay, let's figure out what the information package about that would look like. And so often youth and families, that might be the spot that they're engaged in. And so conversations about an information package will often lead to many questions about, why the program is this way, because providers may come and say, okay, this is who the program's for, this is the service that's being delivered, this is how it's being delivered, this is the disciplines of the staff that are involved. And sometimes in those conversations about, how do we put this in youth and family friendly language, will often lead to questions that are related actually to earlier decisions. And so anytime that we're doing work, period, not work where we're like, we should engage youth and families. When we are doing work, that is how we embed engagement. We say, all right, in order to do this work the best that's possible, whose perspectives do we need? And sometimes, when we say from start to finish, that can feel like, wow, we don't have resources for that. We don't have time for that. We don't have youth and families for that. Sometimes that a little drop of deep engagement very, very early on, what should this program be? What do youth and families need? What should it look like? Having that conversation deeply at the very beginning can change the trajectory of an entire project with something small at the beginning. And we've heard reference to things like that in other models, that 1 degree difference at the beginning will take you to a completely different destination. And it's far easier to do that early in a process than it is to go down a pathway, have some engagement where you have to take a hard left in order to get to that end destination that you were aiming for. Or you have to say, oh, you know what? We're going to have to come back to that when we do program review next year. And many people do, and organizations have those iterative processes, but it's a lot harder to make change happen than it is to make something different from the beginning in its creation stage. So that's what we're talking about when we say engage with youth and families from the beginning and do that partnership. And there's just so many layers to that entirely. Did I miss anything there, Haruka?
Nope, I think you covered it all.
Okay, there's so many considerations to all of that. We'll share resources that list more of them. So this quote from a family member, and it is a family member that we have worked with, having more opportunities to have those conversations in those shared spaces that Haruka mentioned earlier is key. Families aren't there, then change may not be what we would like to see. And I think that's kind of it in a nutshell. And I think lots of times, people who are creating or improving services often find they didn't end up where they hoped they would as well. And if you travel that route and that journey together, then you're going to have a shared understanding at the end. If you travel it separately, then it's much more of a feeling of that power difference and the who had the power and it didn't turn out. And so it becomes kind of more us and them than it does we're on the same team looking in the same direction together. And so I think that's a benefit as well of engaging early. It's not always going to be perfect, and that's okay. This is a big one too, and I kept changing the name of this one, Haruka. We had this with learning from others, bringing that sense of humility that whenever you're embarking on something, assume you don't actually know all the things that might be helpful to do the very best possible. And many people do bring that perspective. And so expanding it to include, oh, I actually don't know maybe what would be the right spot to engage here or what this program should be. So maybe we need to go and reach out to the people that do have that knowledge and expertise and look at the resources. What does the research say? What evidence is there? Whose evidence was it? Was that, how was that evidence collected? I think around engagement, we're definitely very aware that a lot of the evidence that's out there, and sometimes not just evidence related to engagement, but other services, is based on data sets that don't reflect the diversity of our communities. And so doing active engagement with youth and families in your community and doing that well can really improve that and balance out some of those less encompassing sources of data that we may use.
I think what I would
add? Yeah.
Yeah, I think what I would add to here is that I think we're also working in a context where we're constantly changing, constantly evolving, new funding, new opportunities. And so engagement isn't static either at the same time. Needs of youth and families change over the years too. And even within the pandemic context, engagement practices look really different. And so Louise and I had to just kind of learn what youth and families might need right now. And that was about kind of throwing away the things that we used to do or we were used to, and kind of adapting new practices, asking youth and families for feedback around what engagement format works for you. Do you want to do Zoom? Do you not want to do engagement altogether virtually? How can we make it more engaging? And so having those really transparent conversations and just allowing youth and families to share what would be the best way to engage is I think really, really great knowledge that they bring forward. And so I am always just all about ongoing learning and creating those opportunities, not for the youth and families that we work with, but also for ourselves too, and to be okay with making mistakes and also owning them, and being honest about that with the youth and families that we work with, because we know that we're always learning too around engagement.
Absolutely. It's one of those things where, you know, your expanding sphere of knowledge, the more you know, the more you realize how much you don't know. And I think there's no such thing as an expert in all things. And so when we talk about youth and families having lived and living expertise, that's real true knowledge. That is real true evidence. And it doesn't have to be objective evidence or subjective evidence. It's experiential evidence that is knowledge. And examples might be, say, services that maybe have some referral pathways or things like that across different sectors. So something, you know, in the education sector, so people's experiences while going to school that link with mental health, and then there's pathways into maybe some community-based services or connections in the health system and across. And only the youth and families actually have the knowledge and experience of what those connections are actually like. Providers will know how they planned them to be, but not necessarily how they actually unfold. And that's knowledge that's not captured unless we do engagement and do it well. Okay, go for it.
The pictures of all the tools that were on the slide there,
yeah.
we're more than happy to share as well. There's a lot.
There definitely is a lot. I do want to highlight, if you see the one at the bottom, the PPEET, McMaster, nice job. That tool is, that's the, oh goodness, it's the PPEET. My brain's not going to remember the full acronym. A tool to evaluate engagement experiences is broadly used. Okay.
So, yep, this point gets a little more into the practical side of things, as well as the importance of critical reflection in the work that we do, around how can we make engagement as meaningful as possible in the system that we work in. And so what's really possible? Why or why not? Where are we? Are we in the beginning of the process or at the end of the process? Would youth and families see it differently? Timelines are a huge part of, I think, a lot of the engagement work, and where we kind of get stuck at times, because engagement can take time too. Sometimes we don't get as far as we plan to in a meeting, and Louise and I like to work from like the flexibility side of things and being okay with that, but sometimes mandates from the ministry doesn't want that flexibility, or may allow and create spaces for that type of flexibility. And so how do we kind of work within that? Just the fourth one I really want to highlight is the who could help bring youth and families into this process? What are their roles? What do youth and families need to know to feel that competency that youth and families might lack when they're in a system work, just because it's very different from their experience of service. Language is a huge one too, where even the PPET, the acronym, we often have times where they're like, what does that acronym stand for? So it's little things that we might even miss as providers, as just knowledge of, and system language is the word that we use often. But just outlining that for youth and families and creating mechanisms to do so. If youth and families want to send you a chat on Zoom privately, do you have that function on? So there's lots of small nuances that we've learned over time that we would love to share with all of you, if any of you are interested, around engagement and the little things that we think about before we have the meetings. And then the last one is just so important in ensuring equity and inclusion. Whose voices are we missing? Who are we not reaching? Who are we not engaging? And who are we not hearing from that's preventing access to engagement with us, but also within the system too? There's many youth and families out there that we're not currently serving, and we really need to be engaging them and hearing from them around how do we make access to services better. And something that Louise and I are definitely still working on too. We know we have gaps in the voices that we're hearing from, but we're definitely conscious about that and mindful about making that more accessible as well moving forward.
I think sometimes as well that reflecting critically also means creativity. And there's a lot of research and science behind how creativity is critical thinking. And we talk about, reflective practice and ongoing learning and, really looking at all those hard questions that that maybe there hasn't been space to look at before. And when we intentionally work to meaningfully engage youth and families, and if this is a different way of doing things for you or your program or organization or the area that you work, in order to do that well, there's going to be change that happens in our existing processes and structures, and that change is good. And sometimes radical change is what's needed, and sometimes it's not the process that changes radically, it's how we approach it. There's so much that we could say about it's not just what you do, it's how you do it. Because if we put it on paper and say you did this, or we did this, it can look pretty good. And a youth or family who experienced how we did that could be like, well, that was okay. That was, man, that part was really good. This bit sucked. And understanding the nuance is how we've built our understanding. And if we just kind of took that average and overall, we got, 3.8 out of 5, if we were actually evaluating things with measurement tools that measured it that way, we'd be like, oh, that's not bad. That's not bad. When really there might have been something in it that was really terrible. And if we don't pay attention to that, and I don't like using the term outliers in that, because if one youth or family has had that experience and we're only engaging a small number of people at a time, when you scale that out, it's going to be a significant number. And so always having that awareness is super important. And I see it's 1 o'clock. All right, skipping forward. Here we go.
I think this young person's quote just summarizes everything that we talked about today very well in a neat little fun 2 sentences, whereas Louise and I just blabbed on about it. But if you could take away anything from today's presentation of ours, that engagement is active and effortful and can be really messy at times. And it requires us to be critical and just reflecting constantly and being intentional about engagement as well.
Here's your key takeaways. Make meaningful engagement a priority. Create those safer, braver spaces and create them with youth and families. Share that power, or for us, the ideal space is one where power feels absent. Partner from the beginning, bring that learner's mindset, get comfortable with being vulnerable yourself, and reflect critically always.